Hello, this is the audio for the article that was assigned for week 6 of your asynchronous humanities work. This article is called Why It Takes More Than a Grocery Store to Eliminate a Food Desert. It was written by Sarah Corpy and it was published in PBS NewsHour. Important to keep in mind, this is actually the transcripts from an interview between a NewsHour reporter, Sarah Corpy, and Stephen Cummins, who is let's see, there he is there. He is a professor of population health at the London School of Hygiene and Tropical Medicines. So keep that in mind as we're reading along. You're going to find that the format or the structure of this particular article is a little bit different. As always, you're going to actively read along as you are listening to me read this article for you. Pause it as you need to. Spend some time going back into the text, responding, reflecting, so that you can take careful and thorough notes. All right, so let's get started. Why it takes more than a grocery store to eliminate a food desert. So it starts out with a quote that was given by Michelle Obama during her Let's Move campaign. And it's important to notice that it says, this was published in 2014, and this quote was given 4 years from then. So the quote is actually from around 2010. It is now 2021, so we have to recognize that a lot has happened since then. So keep that in mind as you're reading. So the quote reads, "Our goal is ambitious. It is to eliminate food deserts in America completely in 7 years." Michelle Obama spoke these words almost 4 years ago to students at Philadelphia's Fair Hill Elementary School as part of her Let's Move campaign to end childhood obesity in the United States. But the topic of her speech went beyond the issues of child health and nutrition to focus on a related and just as critical issue. 23.5 million Americans live in areas without supermarkets or other places where they can access fresh, nutritious foods. To change the situation in these areas known as food deserts, Mrs. Obama called for action. This is happening all across the country. We're setting people up for failure if we don't fix this. Fast forward to 2014, though, and the problem of food deserts and their effects on diet and health still persists. So again, this was written in 2014. We know that it is now 2021, and still, now, I guess 11 years later, this is still a persistent problem. The U.S. Department of Agriculture has mapped thousands of locations across the country where residents continue to live in low-income, low-access areas. Those who live in these areas are often subject to poor diets as a result and are at a greater risk of becoming obese or developing chronic diseases, all of those metabolic diseases we learned about last week. So why hasn't there been a more drastic change? It's not for lack of initiative. For example, Pennsylvania has launched a program whereby 88 new or expanded food retail outlets have been created, giving healthy food access to around 500,000 children and adults. And in fact, when the House passed the long-awaited Farm Bill on Wednesday, it included a provision for the Healthy Food Financing Initiative, which would allocate $125 million for expanding food resources in underserved communities across the nation. If you are interested, please use these links so that you can learn more about some of these initiatives and acts. The problem may not lie solely with food accessibility. It could also be due to people's shopping and eating habits. Stephen Cummins, a professor of population health at the London School of Hygiene and Tropical Medicine, suggests that merely adding a new grocery store to a neighborhood won't be enough to motivate individuals to shop there for healthier foods. If you think about Kevin Costner in The Field of Dreams, if you build it, they will come. I guess that's the kind of logic model that underpins these interventions. But that doesn't do everything it's supposed to do, says Cummins. It can improve perceptions of food access, but it doesn't necessarily translate into a behavior change. Could that be why more food deserts haven't truly been eliminated? In his new study published in the journal Health Affairs, Cummins examines how adding a supermarket to a food desert can change or not change the shopping habits and diet of those who live there. Surveying hundreds of residents in the grocery store's neighborhood, Cummins and his team sought to underpin the impact that the store had on individuals' fruit and vegetable intake, BMI, and perceptions of food access. Cummins sat down with the NewsHour last week to talk more about the study and its possible implications. Okay, so here starts the interview. PBS NewsHour. Stephen, thank you very much for speaking with us today. First off, give us some background. What's the current policy surrounding food access in underserved communities? Stephen Cummins. In the last 15 to 20 years, particularly in the U.S., there has been a lot of debate among researchers and policymakers about what to do about things called food deserts in underserved or low-income communities throughout the U.S. There's lots of good research out there that tells us that a lack of access to food resources in a neighborhood is associated with a range of diet-related chronic diseases such as diabetes, obesity, and cardiovascular disease. So it's very plausible and entirely reasonable that people come up with interventions to promote food access in deprived communities. The issue is, though, that despite the loads of policy over the past few years, both from local initiatives such as Pennsylvania and New York City, as well as national policies like those promoted in the Let's Move campaign for childhood obesity, we don't know whether these kinds of interventions are effective. What I mean by interventions is increasing food access by encouraging supermarkets to locate to underserved communities, usually through packages of tax and incentives. So that's the context. And our study is essentially an evaluation of what happens when you put new food supermarket in one of these underserved communities. So then PBS NewsHour responds, on that note, explain a little more about your study. What were you aiming for and what did you find? Cummins responds, we focused on a supermarket in Philadelphia, which was funded under something called the Pennsylvania Fresh Food Financing Initiative, a statewide scheme where about 88 new stores have opened up in underserved communities throughout Pennsylvania. They've had financial support through grants and other types of financial incentives to relocate to these areas. With that in mind, we undertook an evaluation to see whether actually locating these kinds of stores in these kinds of places makes a difference to diet. In our study, the headline finding is that we don't really find any direct impacts on diets, as measured by fruits and vegetable consumption as well as obesity. But we do find improvements in the people's perceptions of their access in their food environment. They think that things have gotten better in their neighborhood, but haven't necessarily turned their awareness into a change of behavior. So that's the main finding. But the second finding, which I actually think is more interesting, is that when given the opportunity, very few people try and switch to using newer or better provisions with their local community. PBS NewsHour then asks, and why do you think so few people switched or changed their diet habits when the new grocery store opened? Cummins' response, we didn't actually collect information about this in our study, but we have done some other work related to this in the UK. And it's kind of very interesting, actually. When you go and interview people about how they shop, you tend to find that they have routine places to shop that they're familiar and comfortable with. We had a woman in one of our UK studies who actually lived next door to a brand new supermarket, but still traveled to an area over 3 miles away because that's where she was born, that's where she grew up, It was a place she had connection to. So there are all sorts of other reasons, apart from the rational ones, around cost when people make these decisions. I guess it's also to do with the fact that these kinds of stores might not always sell cheaper food. People who are on low incomes tend to be very savvy shoppers, and they often shop around using multiple stores to get the best deals on a range of items. So you tend to find that people who are on low incomes move around the neighborhood a lot, even if there is a time cost. Another insight to be had is that when you shop in a modern supermarket, you're assaulted. Your senses are assaulted. There's a greater range of choice that can tempt some families to overspend or purchase foods that don't comprise elements of a healthy meal. So if you're trying to avoid all of those other temptations or incentives to not spend money in the way that you would like, then you often avoid those kinds of opportunities to purchase food. PBS NewsHour then says, in that case, do you think researchers and the media may have jumped the gun when reporting on food deserts? Cummins. Well, no, not really, actually. I think the evidence is very well established. It tells us that, firstly, food deserts do exist in many urban and rural areas in the U.S. They are a reality for many people who live in disadvantaged circumstances, either low-income communities or other kinds of communities that might have poor access to neighborhood resources. Also, the evidence does tell us very strongly that those who live in these kinds of neighborhoods do tend to have poorer diets and are at an increased risk of chronic conditions. So that's not in dispute. The issue here is that actually very little research evaluates the effectiveness of interventions. We know that an association exists, but we don't know much about what happens when you try to change the environment. As often is the case in politics, policies are made from the best available evidence and with the best intentions. So in this case, policy has been made from the wider body of evidence that supports an association. Since when it comes to looking at the effectiveness of intervention, the evidence base is incomplete. And clearly, I think it's worth mentioning that people do need to be able to access a reasonable range of healthy food at a reasonable cost. My message is that just building supermarkets to increase access will only take you half of the way in improving diet. If you think about Kevin Costner in The Field of Dreams, if you build it, they will come. I guess that's the kind of logic model that underpins these interventions, but that doesn't do everything it's supposed to do. It can improve perceptions of food access, but it doesn't necessarily translate to a behavior change. So then PBS asks, how strong is your message, though, considering that your study only looked at one grocery store in one community for just 6 months? Cummins responds, when we were funded to do this work, it was actually intended to be a pilot study with the idea of generating some interesting findings that could then be used to essentially run a definitive study further down the line. That didn't happen for various reasons, one of which is that the recession happened, and the supermarkets opened 3 years later than it was supposed to. So the opportunity passed, I guess. But you're right, this is a pilot study, and it's a small one at that. We also know from looking at business literature that stores often take a fair bit of time to bed into the local community. In some cases, there might be an uptick in usage, which then tails off. In other places, it might be that it takes a very long time for people to become used to the store and see it as a routine place to go. It may be that our study, which only lasted 6 months, is not enough time for people to really realize that it's there and use it for their main food shop. So if we took a look at this one 2 or 3 years down the line, we might see a greater amount of people who have adopted this store as their main store. I wouldn't want to hang my hat on the findings, but we need larger studies in more diverse communities that follow people for longer. But I guess the strength is that even though the work that doesn't exist in this area has been quite small, but I guess the strength is that even though the work that does exist in this area has been quite small scale, it's remarkably consistent in its findings. PBS NewsHour. So, what will be more effective in helping improve people's diet and health in these regions? And what should future policies focus on? At a basic level, people need to have good access to food. But good access does not necessarily mean you have access to a supermarket such as Walmart or Kroger or somewhere similar. It can also include other kinds of food outlets, such as farmers markets, community food initiatives, and actually even convenience stores. I think there should be better support for the convenience store sector. Poor neighborhoods in the US and other countries tend to have very large and diverse convenience store sector, and many people do their shopping there. So trying to get good food in those kinds of places might be an additional way of some thinking about improving the food environment in those neighborhoods. In addition to improving physical access to food in disadvantaged neighborhoods, you also need to think about policies that help bridge this gap between perception and action. These might include things such as economic initiatives, like taxes or subsidies for healthy foods, but could also include harnessing in-store marketing to promote the purchase of healthy foods as opposed to unhealthy foods. There's also evidence that suggests you need good health education programs that teach the skills needing for buying and cooking healthy foods. We've done some work here in the UK where we followed consumers around the store as they actually buy food. Even though all of them were from low-income communities, they all had different strategies about how they decide on what to put in their shopping baskets. Some people are incredibly good. One woman used to put her total budget on her mobile phone's calculator, and every time she purchased something, she would take that amount of money off the total. When it reached zero, that was it. She was very disciplined. But others have a more chaotic approach, shopping by offers like 2-for-1 deals, and at the end of the day, once they spent their total amount of money, they would look in their basket and realize they had a bunch of items that they couldn't construct a meal from. So even though people from disadvantaged neighborhoods are tagged in the same way, there's a real diversity in how people behave when it comes to buying and cooking food. We have to think very carefully about giving people the skills to make better decisions when they're in stores, as well as providing them access to the stores in the first place. So PBS NewsHour then says, what do you want people to take away most from your study? And Cummins responds, I want to stress that supermarket interventions, even though I don't think they're necessarily effective in the way people think they'll be effective, are very important. And I'm actually quite supportive of them. Access at the basic level is something you need to have before you have anything else. But the key message I want to get across is that they're just not successful on their own. We need them plus a range of other things that might make a difference to improve people's diets. You've got to think about the culture around shopping and eating food too. All right. So there's your article. It's quite a long one. Reach out if you need me. And of course, as always, I have office hours. So if you'd like to do this together, you can schedule to see me on Mondays or Thursdays.